All right, so far we've looked at bundle branch blocks in general, how to detect them. We've looked at left bundle branch block and right bundle branch block and what they look like and how to detect them. We've looked at left bundle branch block and what's normal and what might be pathologic. In other words, what might be a STEMI on an electrocardiogram with a left bundle. So lastly, let's look at right bundle branch blocks. So right bundle branch blocks use a little bit different of a rule system than a left bundle branch block. So let's walk through that. So we talked about discordance and concordance already. We remember what that means. So let's just take a look at right bundle branch blocks. So when we look at what a right bundle branch block does physiologically, it causes ST depression and it flips T waves, but it does not create ST elevation ever. So that's the good news there, right? That makes it really easy. It's another way of saying in right bundle branch block, you can find STEMI. Pretty easy. It's going to have the same patterns like a normal electrocardiogram would when you're looking for STEMI. Just remember that ST depression, which could signal ischemia, or it could signal a reciprocal change, ST depression is a normal variant of right bundle branch block. So that might be a little bit trickier to find ischemia. Same with flipped T waves, right? And it may be a little bit harder to recognize, find a reciprocal change just because a right bundle branch block causes ST depression. So when we look at this electrocardiogram, we can see that it has supraventricular activity as P waves. When we go up to V1, we can see that the terminal force of the QRS goes up, right? So if we look here from the T wave going back to the junction, the last portion of the QRS goes up. We push our blinker up to go right. It's a right bundle branch block. And when in a right bundle branch block, it flips T waves and causes ST depression. You can see ST depression here and here. You can see flipped T waves here and here, right? There's some more flipped T waves over here. So that's very common of a right bundle branch block. But what it doesn't have on here is it doesn't have any ST elevation as part of a physiologic finding of a right bundle. So now let's take a look at another version of a right bundle branch block. Here's one with a fair amount of artifact on it, but we can clearly see that there are P waves over in here and in the early precordials. So it's a supraventricular rhythm. It is clearly wide. We can see from the beginning of here all the way to there is very wide. We go up to our QRS duration. If it's greater than 0.12, then it's a bundle branch block. We go to V1, we find the T wave, go back to the junction. From the junction, the QRS goes up, the last terminal portion goes up. We push our blinker up. That is a right bundle branch block. So we would expect to see ST depressions. We'd expect to see maybe some flipped T waves if there's some in here. There's one here, for instance, right? There's one there. There's one right there. Those are normal, but ST elevation is not normal. And so we can see that there's some ST elevation here in AVL. If we look at the other lateral leads, we don't see any ST elevation. So we just have it in just the one lead. We can also see that there's ST elevation up here in V1. There's the junction right there. And also right here, there's the junction. So there's ST elevation in V1 and V2. This just has kind of a tall T wave, but from the junction point, it looks pretty isoelectric. And that has depression. So clearly we have two in the septal lead, so we can call this a septal infarct with a right bundle branch block. And it's probably going to end up being something larger than that, probably going to be the septal. It might hit the circumflex a little bit, which reminds us that as we do serial 12 leads on this, we might see this start to catapult into not just a V1 and V2, but a V3 and V4, and maybe a V5 and V6. And maybe a lead 1, which would give us this big antroseptal with lateral extension, just because we can see it starting to grow over here. So remember that 12 lead interpretation or 12 acute coronary syndromes is a very dynamic process, and you may not get the whole picture right away, and that's why multiple 12 leads as you have the patient might be helpful to understand what's progressing or what's regressing. But for sure, we can call out a STEMI right there in the septal lead. So that'd be a septal MI with a right bundle branch block. So just remember the rule with right bundle branch block is STEMI can still be found but an ST segment depression and flip T waves are normal physiologic findings of a right bundle. So let's talk about that in summary. Right bundle branch block can cause ST depression and inverted T waves. That's its normal variant, or what we call physiologic. You should be looking for ST elevation when evaluating a 12-lead ECG with right bundle branch block, because that is generally pathologic. It's very, very, very uncommon to see a right bundle branch block with ST elevation that is not pathologic. In our sense, we would say probably from STEMI. ST elevation in even just one lead is highly suspicious. Once again, you it may be masked enough, just like it was in the left bundle, that you may not get a perfect picture, right? But you see one lead, that might be enough to be highly suspicious. Clearly, when you see two leads in two contiguous leads, then we would call that pathologic, and that's probably a STEMI. A right bundle branch block with normal variant does not mean that there's no ACS, right? So remember, we always go back to a normal 12 lead does not mean a person's not having a STEMI, not having an MI. It just means they're not having a STEMI MI, right? They're not having an ST elevation MI. So remember that just because you don't see what you're looking for on a right or a left bundle branch block, we still want to go back to the patient, a good history, clinical evaluation to understand risk stratification for acute coronary syndrome. But there's a couple of helps on one, how to figure out bundle branch blocks, what a right bundle and a left bundle should look like, and what a right bundle and a left bundle shouldn't look like, so that when we do some cases here in a couple minutes, you'll have that ammunition if you didn't have it before, and that should help you do the test your knowledge area a little bit easier. All right, thank you.